My name is Vanda Jenwright. I will be giving my information speech on seizures, specifically grandma seizures. Grandma seizures represents the most frequent form of epilepsy seizures. There are 4 phases of grandma seizures. You have the predominant phase, the oral, and the technical-clonic phase, and the postictal phase. During the predominant phase is present in 20 to 30% of patients and may last for several hours or up to a maximum of 2 days. Symptoms are mood changes, headaches, depression, irritability, urination, sleep disturbances, and difficulty concentration. These symptoms are usually observed by family members, not the patient. The second phase is the oral phase. It is present in 50% of patients, lasting 5 to 15 seconds. Symptoms are palpitations, perceived flashes of light, olfactory or taste hallucinations. The third phase is the tonico-clonical phase. The tonico-clonical phase has a brutal onset with loss of consciousness and fall with the possibilities of injury occurrences. It involves 2 subphases, the tonic phase that lasts 15 to 20 seconds and the clonic phase that lasts 30 to 40 seconds. The tonic phase begins with muscle contraction, extension of arms and legs, apnea, which leads to cyanosis. The clonic phase follows the tonic phase, which is muscle relax for a variable period of time and is characterized by psychotic and synchronous convulsive movements. The last phase, which is the postictal phase, which is considered a post-critic coma state that lasts from 1 to 5 minutes up to 20 to 25 minutes. Variable period of unconsciousness during which patients become quiet and breathing resumes. Patient gradually awakens. Headache and muscle weakness are common during this phase. The first aid, like when a patient has or a person have convulsion seizures as grandma seizures, there are certain things you can do to help the patient out to make sure they don't injure themselves. For instance, okay, I'm going to use some assistance. Say for instance, if the patient is like sitting in a chair and they go into a convulsive grandma seizure, you just take the patient and kind of like let them fall down to the floor. Just let them fall down to the floor. Make sure patient is on their side. And make sure no objects are in the way so the person won't injure themselves. And to keep them from, hitting their head, you can like place a pillow up under the patient's head to keep them from injuring their head or like bumping it on the floor or anything. And you do not try to like restrain the patient or hold them down to keep them from, having a seizure. Don't stick anything in the patient's mouth. You just let the seizure take its course and just let the patient come out of the seizure on its own. But do not, try to refrain the patient like holding their legs or holding their arms and things. And do not put anything in the person's mouth, your fingers or anything. So when the person comes out of the seizure, they may be unconscious and, don't know their whereabouts. So you just have to get them time to come out. But then when they come out, you can help them up and, get them to a safe place, like put them back on the chair so they can get themselves together. And this is my speech, and I hope it has taught you a lot, and I hope you enjoyed it. Thank you.